Hello and welcome back to another episode of the Health Talks. I'm Dr. Shahad Mohammed Abulanain and I'm the host of the podcast. When people hear the term plastic surgery, most immediately they think about cosmetic procedures, but in reality the field is much broader and often life-changing. From reconstructive surgeries after trauma or illness to procedures that improve function and confidence, plastic surgery is far broader than aesthetics only. Today, we'll be exploring what plastic surgery actually includes, the difference between cosmetic and reconstructive procedures, and also something patients don't think about often, which is scarring, healing, and recovery. Joining me today is Dr. Faisal Ameer, consultant plastic surgeon and reconstructive surgeon at Thumbay University Hospital in Ajman. Welcome, doctor, and thank you very much for joining me today.
Thank you for having me.
Amazing. Dr. Faisal, let's start from what is plastic surgery? What does plastic surgery include as a specialty?
Okay. So the name plastic surgery is quite misleading actually.
Right.
And many people think that it has to do something with the polymer plastic, which is in cups and plates and saucers. But the word plastic comes from the word plasticos. It's a Latin word which means to mold. And that's what the specialty is all about. Molding tissue, changing the shape of tissue, transferring tissue from one place to another to achieve a desired effect. And the major, let's say, branches of plastic surgery is the reconstructive, and the other one is aesthetic or cosmetic. Now, reconstructive plastic surgery is to do with shape and form and restoration of function, and cosmetic is about just enhancing the look of tissue. So it's a broad specialty and has to do with plastic surgery of head to toe.
Right. And why do people always associate it with cosmetic procedures only?
So it has a lot to do with movies and now with social media,
right,
and how it is portrayed. Since childhood we saw movies wherein gangsters will get plastic surgery, they'll change their faces with some surgery so that they can escape police or law enforcement. But plastic surgery is beyond all this, and I have so many examples of people coming to me, and they would be surprised that they were referred from other branches of medicine to a plastic surgeon for a functional problem. Because in their mind they're thinking that it's just cosmetic surgery.
Okay, that's enlightening. Doctor, can you tell us the difference between reconstructive and cosmetic surgery? Like, what do each actually involve?
Okay. So reconstructive surgery happens either after, let's say, loss of function or form of a limb or part of body because of, let's say, accident or trauma, or sometimes because of cancer surgery, sometimes a part has to be removed. So restoration of form and function is reconstructive surgery. And that could be, ranging from arterial or muscular or skin or nerves sometimes. So restoration of function or form of a part of a body has to do with reconstructive part of plastic surgery. Now, cosmetic surgery, on the other hand, is purely aesthetic. So how does a part look like? For example, an eyelid or a nose or ear shape or facial features, and how they affect the appearance of a person and how it can be changed in a positive way to enhance the look of that part.
Right.
It's equally complicated, equally challenging. So it's not superficial, as if some people think that it's just a quick fix to one of your problems, but it's not. It's scientific based, it's evidence based, and it's equally challenging.
Right. And so reconstructive part is more related to the physiology, and the cosmetic is more the anatomy involved, right?
You could say that, but equally important to know how anatomy works or vascularity works when we are doing reconstructive procedures. Let's say a lady lost her breast because of breast cancer. So reconstruction of this breast will require scientific anatomy principles in which restoration of form has to be done, tissue has to be transferred, it has to be based on vasculature, blood supply, so that it's viable tissue going from one part of the body to another. So it is based on core principles of medicine, anatomy, physiology, and equally true with cosmetic surgery. If we don't respect anatomy and physiology, the basic principles of medicine, we are doomed to fail, whether it's cosmetic or reconstructive.
Thank you very much for highlighting that, doctor. And can you give us a few more examples of the types of reconstructive surgery, like ranging from very simple ones, like you said, you get easily referred to plastic surgery and patients get surprised by that fact, to more complex ones?
Right. So I'll just quote a small story which happened almost a year back with me. So a young man of almost around 35 to 40, he came to me, and the complaint he had was pain in his right arm. Okay. And it was so, let's say, disabling to him that he could not do his day-to-day function. He used to play sports, he stopped that. Even while wearing a shirt, he would be, feel that pain. Yeah. So it was really difficult for him. And he had been suffering from this for almost 5 to 6 years. Oh. During this period, he went to neurosurgeons, he went to physicians, orthopedicians, he went to so many branches of doctors. He went to 25 hospitals. He went to 3 continents where he consulted different doctors, either online or physically. He traveled to multiple hospitals. He got almost 30 CT scans. He underwent 15 MRIs.
That's extensive.
2 surgeries were done which did not relieve his symptoms. And then somebody told him that you should go to a plastic surgeon. And he was like, first question he asked was, I have no idea why I'm here, but I have tried going to alternative medicine. He even saw a psychiatrist because people labeled him that it's a functional problem. It's not something which is related to anything organic. So people labeled him as a psychological patient. Oh, even his family was like, you keep on complaining, so I don't know what is wrong with you.
That's very distressing.
So distressing. So I tried to explain to him, and we tried to do a couple of scans again, and with a close, let's say, communication with the radiologist, we could pinpoint a tumor in his arm, and this was a 6 millimeter tumor. 6 millimeter of course, what is 6 millimeter. It's the thickness of the eraser on the top of the pencil. Wow. So that small tumor was causing that pain. It's called a glomus tumor. Luckily, we did that surgery under a microscope. We removed that tumor. We sent it for biopsy. It was positive, of course. But most importantly, all her symptoms were gone, completely resolved. And after an ordeal of, let's say, 6-7 years, all these scans and going to so many doctors, he never believed that it would happen in a plastic surgery, clinic. So just to give you an idea, it's not related to beauty, it's not related to cosmetic, but right. Yeah, it was a good success story.
That story actually portrays the beauty of plastic surgery beyond just aesthetics. So
absolutely.
Aesthetics can be like just a small component of a bigger specialty.
100%.
Great, thank you very much for highlighting that, doctor. And what's the difference in goals-wise? So goals-wise between cosmetic procedures and reconstructive procedures, like more focusing on cosmetic procedures now.
Yes. So let's say we are doing a procedure for cosmetic reasons, there is hardly any room for mistake.
Right.
So I'm not saying that you can do mistakes in reconstructive, but then even let's say a wavy scar is unacceptable. A broad scar, unacceptable, right? It has to be thin, it has to be hidden, it has to be perfect result, because everyone has an opinion. Like plastic surgery is something which happens on the surface. It's not something which is deep inside the abdomen, for example.
It's easily visible sometimes.
It is easily visible. So your friends will have an opinion. Your relatives, your kids sometimes will say, Mom, what did you do? Or Dad, what did you do?
Right.
So everybody has an opinion about plastic surgery. So it's very easy to let's say, find that, okay, 9 out of 10 or 7 out of 10.
Very subjective.
Yes. So it has to be accurate. It has to be perfect when you talk about cosmetic surgery. There's no room for, let's say, suboptimal result. So that's why it's so challenging. On the other hand, reconstructive is more about function restoration. Let's say there is a crush of hand. So our aim is to restore function as much as possible. So even if we get 80% of function of hand, we are still doing great for the patient. So it's more forgiving, challenging, but still forgiving. But cosmetic, on the other hand, is no forgiveness at all. It has to be on point, otherwise it's a failure.
Because the primary goal is the physical appearance of it, so
Yes.
it needs to be perfect or
Yes.
beyond.
Yeah.
Exactly. Thank you very much for highlighting that,
Thank you.
Dr. Faisal. Now, let's go back to the real impact of plastic surgery. And can you give us more examples of how plastic surgery can, like reconstructive plastic surgery, can change a patient's life, especially ones managed at Thumbay University Hospital in the Center of Plastic Surgery and Reconstructive Surgery?
All right. So let me just quote another story from my cases. This was an old veteran of war in South Sudan, and almost around 25 years back, he was operating. He was in army. He was operating in artillery, and there was an explosion. He deformed his limb. There were multiple injuries with shrapnel, so there was infection, multiple fractures. So somebody put an external fixator, which is like metallic supports around the leg, but that surgery was not successful. There was infection in the bone, which is known as osteomyelitis. So the leg kept on pouring pus.
Oh, it
And
got infected.
It got infected. It got deformed. So he could no longer put weight on his leg, and there were no like prosthetics available to him. It was an economically, challenged, war-torn area. So at one point of time, he was actually crawling inside his house. So for almost around 20 years, struggled, different doctors.
20 years.
Almost 20 years. And then one, stroke of luck, the government said, okay, we'll treat our veterans. So they sent him to UAE on their own expenses. So he came to us, we did some x-rays, we did some scans. With the orthopedic surgeons, we planned to correct the deformity, remove the infected bone, and put a fixator. So the aim of this was, even though when we remove some part of bone, it is going to shorten the leg, but still he would have a straight leg with no more infection.
And he can move it as well.
Exactly. So we ended up doing almost a 14-hour surgery, in which all the infected bone was removed. My orthopedic colleague did a wedge osteotomy, in which the straightening was done. We put in a fixator, and then I took some muscle from the arm, from the shoulder, and then took this muscle with vascularity, did a microvascular surgery, and then the wound healed in a matter of almost around 5-6 months. So after 5 to 6 months, he was able to walk. So you can imagine how a person who was not able to walk for almost around 20 years walks again, stands with me and takes a picture and says that I'll show this to my kids.
Yeah, within 5 to 6 months, so that's a very short period of
Absolutely,
time.
compared to the 20 years of struggle.
Of suffering. So
Yes.
it definitely goes beyond appearance, beyond of
Yes.
how pretty it looks. It goes
Absolutely.
to functionality and the quality of life.
Yeah.
It made a great impact. Thank you very much for
Thank you.
highlighting that story.
So at the end of the day, he only needed a sole raise on the shoe. So he'll wear a normal shoe with a higher sole, because
Exactly.
there is a difference in the length of the leg. But at least he was walking comfortably. You could
That's
tell
amazing.
with the yes.
And you also highlighted the need for like a multidisciplinary team through the consult with the orthopedic
Yes.
doctor.
Yes.
Can you highlight the importance of that when it comes to managing cases in plastic surgery, also in Thumbay University Hospital Institute of Plastic Surgery?
Yeah. So one very important thing which I feel is that more than just being colleagues, we dine together, we eat together, we talk with each other a lot, and we discuss cases. So what that helps is that whenever we have cases which are complicated, we would have, talking points over, with colleagues. We are always discussing. And that way we are not just writing a prescription that, okay, get an MRI done. We don't say that. So we talk to our radiologist, for example, and tell what exactly we are looking for. So, you know, that might be another negative MRI. Like for example, the other patient I was telling you about, this painful arm, I could have just ordered an MRI. It could have been a negative MRI and then nothing achieved. But then talking to the radiologist and telling exactly what is the history behind this and what we exactly are looking for, then he could set the parameters of that machine and get us the real results.
Exactly.
So it's not just surgery, it's that investigation protocol and working with our colleague to find an answer. Plastic surgery is basically a problem solving branch. So we find a problem, you know, we think about what are the solutions and how other specialties, other branches can you know, help in this. The best part about working in a hospital which has, you know, closely knit colleagues is that we always talk and discuss over phone or physically. We can just go to their office and discuss a case. That's why, you know, I would say that it's always better to, you know, rather than prescribing a prescription, always better to talk to the other doctor and tell what we actually want.
Right. So you've established a supportive team, and that's the beauty of success as well in medicine. Exactly.
Yes.
That helps you not just become good doctors yourselves, but bring good outcome for your patients.
Yeah.
Amazing, Dr. Faisal. Thank you very much for highlighting that component. The supportive team and the efforts of everyone, it makes a greater difference as well.
Absolutely.
In the quality of care you give the patients. So Thumbay University Hospital pioneers in many fields, including plastic surgery, with the Center of Plastic Surgery and Reconstructive Surgery. Can you highlight the types of services that you offer patients so our audience are more aware of what can they actually approach the hospital with if they have a problem?
Okay. So at Thumbay Hospital, in plastic surgery especially, we do a lot of routine work. Of course, you know, most common requests are like, let's say, liposuctions and rhinoplasties, neck lift, facelift, blepharoplasty, you know, simple, straightforward things. Of course, they have to be, you know, backed by science and evidence-based. It has to be correct. We have to take all precautions. It has to be a safe environment. It has to be, you know, good result ultimately. But we also do a lot of atypical cases, like we do non-healing wounds, for example, bedridden patients with bed sores. We do, you know, trauma which, you know, which leads to disabilities like foot drops and wrist drops and nerve injuries. So we do all of that also. I'm actually really proud of one of the cases that we did, which was 3D printing a missing bone in a 9-year-old boy.
Wow.
So this child came to us from Nigeria. I've told this story. I mean, I'm really proud of it, so I tell this story often to my students.
Cannot wait to hear it.
Yeah. So this was a 9-year-old boy who went to a vacation to his grandparents and found a gun there. So it was Nigeria. It was like, so they started playing, his brothers and himself. They started playing with the gun, and it misfired. So the shotgun, the pump action rifle actually, it hit. The shot hit his foot. The middle part of the foot was gone, and the distal part was just surviving with some blood supply. And they went to University Hospital Abuja. They went to, you know, multiple hospitals in Nigeria, and they were told that it would be an amputation. So
to amputate the foot.
They advised amputation.
Okay.
Now the parents, they were not accepting that a 9-year-old boy would get an amputation. They were ready to try anything, just with the hope that they could salvage the limb.
Exactly. Yeah.
So the child was brought to UAE. They consulted multiple hospitals in UAE also. Unfortunately, most of the hospitals, they said that amputation would be a better choice rather than trying and, you know, putting the patient into, let's say, trouble. Because the recovery is long, it takes a lot of surgeries. So is it the right approach to do all these multiple surgeries on the child and wait for a salvage and maybe then fail at the end?
So you're thinking about the best interests
Yes.
of the patient as well?
Yes. But then luckily the parents brought the child here, we saw that child, and somehow we had a plan which could work. So we discussed with the parents, the child was also somehow psychologically very happy with us, got some good vibes probably.
That's great.
Yeah, so the mom said, okay, let's give it a try, because they were trying to find an answer to salvage the limb. So we did first surgery, which was just to get rid of the wound. It was again 12 to 14 hour surgery. It was a long surgery in which we did a flap cover, microvascular surgery, and we ended up with no wound on the foot. So we completely healed the wound. But for the bone, and it was COVID time, so we had a lot of time to think and plan what we could do.
That's another challenge as well.
Yes. So the good thing about COVID was that we had a lot of time to think and plan. So we planned a 3D printed bone, the missing bone, for the child, because the child was growing, the foot is going to
expand.
Grow and expand. So ultimately we wanted something which would be good for the child, give support, and in the long run not fail like a rigid implant. So we printed a 3D printed bone for the child. It was made of titanium ultimately. So we started with a plastic first, PLA, which is a sort of a filament used in 3D printing. Then we did it in cast iron. We did some mock surgeries, and ultimately we ended up printing it in titanium. We collaborated with multiple 3D printing facilities in Dubai as well as abroad. Ultimately, it was printed in Belgium.
Amazing.
So I've actually brought some prototypes for you to show. So this is the first implant that we printed. This is a PLA implant, and we did mock surgery on this one first, and then we printed this cast iron.
It's a heavier one.
Yes, it's heavier, and ultimately titanium, which was medical grade titanium, and was implanted in the foot of the child.
Right.
Today, I'm so proud of it that the child plays football, runs, and moms keeps on sending me videos. So I'm so
amazing.
delighted.
How old is the child now?
He's 15. He's 16 now this year.
Wow, that's amazing.
And
he has no problem with his foot.
He runs and he plays football, and I'm so delighted to see those videos when the mom herself, she sends the videos. I'm so happy to see all that.
That's amazing. You invested not just time, but also effort and precision into this patient's care, and you made sure that it's a long-term effect. Like it gives you a positive long-term effect. The patient
100%.
wouldn't complain after a few years.
Yeah.
They wouldn't need revision surgery.
Right.
So one-time fix. That's amazing. I'm very impressed, Dr. Faisal.
Thank you.
Now let's move on to the misconceptions part. Of course, there are a lot of misconceptions around plastic surgery and also expectation problems.
Yes.
What's the biggest misconception patients have about plastic surgery from your experience?
So there is a dictum in plastic surgery which says that plastic surgery is a battle between beauty and vascularity. Vascularity is blood supply. So, and this was said by Harold Gillis, who is considered to be the father of plastic surgery. He was, to start with, he was an ENT surgeon, and at the time of World War II, there were so many war-related injuries. So plastic surgery itself, as a specialty, grew at that time when there were so many war-related injuries. So this was said by Harold Gillis that plastic surgery is a battle between beauty and blood supply.
Right.
But in today's world, of course, scientifically it still holds true, but it's expectation versus reality. So patients will come with all sorts of requests. They would bring pictures, they would bring videos and Instagram, reels, and they would like the same procedure to be done on them. Sometimes, Korean beauty standards, they would bring Korean videos, Korean surgeons.
They want that
they want exactly
result.
the same. Sometimes these videos are morphed, they are edited, and these are different, types of patients, they are different age and different physiology and different, so you cannot equate it to final result. Now my aim as a plastic surgeon is to, one, keep the patient safe, provide the best possible solution which the patient is asking, but at the same time to also keep myself safe. Now let's say a patient has unexpected, let's say unrealistic expectation, for example. Now in that case, what will happen is I do a surgery, and after 3 months, 4 months, the patient will not be happy, of course. So it's constant messages, constant calls, and then ultimately nobody is happy, nobody is a winner in this case. So as you grow in a specialty, it's really, really important to find out these are the patients whom you don't want to do, because their expectation is never going to match what you can provide, what is scientifically possible, what is safe that can be done. So all these patients who have unrealistic expectation, these are the patients who will always bring heartache to you. So
right, and how do you assess if the patient is a good candidate for surgery? What are the criteria you follow?
Right, again, if a patient knows that surgery will cause some amount of pain, of course, there will be a recovery period. You will not see a result immediately once you come out of the operation theatre. These are the patients who know what they are signing for. So, of course, when you go to the theatre, there will be anesthesia, there will be some blood loss, there will be some surgery, there will be pain after the procedure. You have to take care of yourself, whether it's hygiene, whether it's antibiotics, painkillers, listen to the doctor. Now, when a consultation happens, if I see that the patient is completely distracted, just focusing on the result and not listening to what I am telling, these are the patients who are not understanding the depth of what they are asking for.
Right, it's an alarming sign.
It's an alarming sign.
So you're emphasizing the importance of counseling the patient extensively before undergoing surgery.
Absolutely.
Right, that highlights the importance of awareness as well, that patients should come with awareness and also ask their doctors about everything from what will happen in the procedure and also outcomes. Yeah,
so recently I had a patient who had a history of 2 deliveries. She had done 2 cesarean sections, and she was requesting for a liposuction. So her skin already had a lot of stretch marks, her muscle was already separated. Now this is a clear-cut candidate for an abdominoplasty or for a tummy tuck. Now I told her that if you do liposuction, you are not going to be happy. So if you do tummy tuck, you are a candidate for a tummy tuck. So she told me something which was new to me, beyond Instagram and Snapchat. So she said, I uploaded 2 of my photos showing my body to ChatGPT.
Oh my God.
And asked ChatGPT whether I'm a candidate for a liposuction or tummy tuck, and ChatGPT said you could get away with liposuction, so you can proceed. Now, and she has a firm belief that ChatGPT is correct, and what I am saying does not match with her, expectation. So she said, no, ChatGPT said that liposuction is okay for me, so I want to do liposuction. So in this case, what are my options? I can either, get a well-written consent form, she signs everything, that she was told that liposuction is okay, but still, she's a candidate for tummy tuck, and doctor advised to go for tummy tuck, but I refused. She will sign it, of course, but she will still not believe it, right? So we have a document which says, okay, doctor, let's do liposuction, I don't want to do tummy tuck, but after 3 months she's not happy. So she's cursing me, she's telling her friends that this doctor is very bad, I didn't get any result.
Your goal shouldn't be just about pleasing the patient, but doing what's in their best
what
interest.
Is right for them.
And making sure that they understand it as well.
100%.
So you invest more time in making them understand and spreading awareness and counseling them properly about their condition before going into surgery.
Right.
Definitely. Now, Dr. Faisal, one of the biggest challenges or concern that patients have is scarring and healing. Are there factors that actually impact that? Can you please let us know?
So many patients will say that I don't want a scar, doctor. And unfortunately, the truth is that whenever there is an injury to the skin or cut in the skin or an incision in the skin, it will always lead to a scar. Now, as plastic surgeons, what we'll do is we'll trick the scar to be in a place where it is hidden. Let's say if we have to operate on the forehead, I would put an incision in the hairline. So it's in an area which can be hidden easily. Or at a junction, let's say I have to do a facelift, so I go really close at the junction of the ear and the cheek, so it's not something which is really obvious. But in most of the cases, the scar will be there, and the patient has to really understand that the scar will be there.
Right.
But the appearance of the scar, the final appearance of the scar is going to be, way different if we take care of the scar, if we do a good job in the theater and take a good care of the scar after. It is going to be entirely different from a scar which is poorly done and poorly taken care of. So, and it depends on the lifestyle, of course. It is how you take care of yourself. Do you smoke? And how you clean the scar, how you massage the scar, how you put ointments and creams, and there is a whole protocol.
Aftercare,
yes,
exactly.
Wound care itself is a science. So it's not just the surgery, it's also the aftercare which is going to lead to the final appearance of the scar.
So there is great importance on the aftercare and
Yes.
taking care of the scar, like
Yes.
from the medical aspect as well, doing the applying the ointments and all of that.
There are so many things, silicone
the-
sheets and
right.
massages and fractional lasers sometimes. So depending on how the scar is behaving. So it has to be not just the surgery. So it has to be a mutual
An
effort.
Yeah, an
Yes.
effort from the patient
Mutual,
as well.
of course.
Amazing, and that will affect the final outcome. It's not just
Yes.
the doctor's job, but also
Correct.
what the patient does.
Correct,
And
correct.
that's important to shed light on.
And also important to make all of this transparent before we go for the surgery, so that the patient understands that this is not something which I'm going to see after 1 week or 15 days. It's the next 6 months to 1 year that I have to really make it a habit to take care of the scar so that it's the best possible appearance.
Right, and now realistically speaking about recovery, because often patients are concerned about recovery and how long it will take for everything to go back to normal, like swelling to decrease and
Yeah.
the final appearance, let's say. Can you tell us more about that?
So there's no set pattern of healing. So everybody heals differently depending on skin types, age, how well you were doing with your health before.
Right.
Any comorbid conditions. Diabetic patients, of course, will heal later or slower, and people who smoke, they heal slower, and they have more of wound problems, more complications. So it's not something which is a set pattern which will be good for all patients. So it's different for all patients, and it's let's say swelling, let's say amount of water retention, amount of inflammation or amount of reaction the skin will be different throughout. So finding a good candidate, explaining that good candidate how things are going to happen and what we expect, what we don't expect, what are the danger signs, when you should come back immediately, when you can just take care at home. It goes a long way to get your final result rather than just going for a fixed pattern.
Are there a few things that patients may be doing unknowingly that negatively impacts their longevity of results?
That's an excellent question, and it's so close to my practice that one thing which I feel in plastic surgery especially is that smoking is the biggest enemy of plastic surgery. Smoking causes vasoconstriction, it causes vasospasm, and this vasospasm can be caused even by one cigarette or one smoke, even with passive smoking. So your friends are smoking, you're just sitting there enjoying the conversation, but you are getting affected. So I've seen disasters, I've seen skin getting necrosed, I've seen wound healing, wound gaping, and people will not blame that to smoking. They don't take that seriously. Even if I explain before surgery that please do not smoke, stop smoking before surgery and during surgery and after surgery, during the recovery, do not smoke. they don't take it seriously. They feel it's just a, it's just a smoke. It's just a not harmful, just a benign smoke. But they don't realize that one smoke will cause vasoconstriction for 24 to 48 hours. And it's going to cause, again, vascularity. I told you, blood supply is going to be the biggest challenge for plastic surgery. So they end up with wound problems, they end up with healing problems, swelling is not going, results are not showing, they are all delayed. So I feel it's one of the biggest enemies that a plastic surgery patient can do to themselves is smoke.
Right, thank you very much for highlighting that and also raising awareness about how aftercare greatly depends on the patient, not just the doctor.
Yeah.
And that smoking can have detrimental effects on your final
Absolutely.
results. So as much effort and time you've invested in that procedure, you don't want it to go to waste by just a smoke.
If the patient is not happy, I'm the saddest person, right?
Exactly.
So let's say there are other factors also. There's old age, there's diabetes, there is malnourishment, there are deficiencies which can cause effect on wound healing. Of course, if it's a diabetic patient, I should not do surgery in the first place, or correct diabetes first and then go for surgery.
Right.
But smoking is something which is beyond my control. I can just explain the patient not to smoke. It has everything to do with the patient's willpower to, resist smoking. So it's something which we cannot control by ourselves. Everything else we can modify, we can do something, but this is something we can just tell the patient not to do it.
Right, so there are factors that you can control and reverse, and there are factors that are just there. It's the patient's physiology, like diabetes, for example. That you can't control. A patient has diabetes, old age.
Yeah, we can just, bring it to the limit.
Exactly, maintain it properly.
Maintain it and then do the surgery.
Smoking, these are reversible factors, and it's important that we're highlighting their effects on not just health in general, but also consequences to whatever their procedure they've undergone.
I completely agree.
Great, thank you very much, Dr. Faisal.
Thank you.
Now, what advice would you give patients before they undergo any surgery, before they seek plastic surgery care? So
I feel whenever a patient has this question that let's find a doctor or find a hospital, it has to be two-pronged approach. One is to find the perfect doctor which suits your and understands your demands, and also to find a hospital which has certain criteria. I'll just come to that. Now, the first thing is, if I'm looking for a doctor, I would look for, number one, experience. I would read real patient reviews. I would like to know what other patients are saying about him. Is the doctor approachable? Can I just contact my doctor, or after the surgery he just disappears? Like, I've seen so many cases wherein star surgeons come from Miami, do a surgery in Dubai, and leave the next day. Now, you cannot contact your doctor. There's another surgeon in the clinic who is taking care of you. He is not the one who has operated. You don't know what is going on. That person also hardly knows what has been done. If they land up in trouble, there's nobody to take care of. So always find a surgeon who's near you, who's approachable, who has the experience to do it, who is skilled enough. So how do you find that the person is skilled or not? So there are so many, let's say accreditation bodies who will, let's say, do a background check. Let's say when I have a license with MOH or DHA, they would do my background check.
Right.
And similarly, there are bodies like let's say Association of Surgeons of USA, or Plastic Surgery Association in UAE. So they have a system of looking at your previous work, whether you have done a particular number of cases. So they'll give you memberships. So you have to see whether this person is accredited, they have the proper training, and then when you meet that patient, that doctor, you have to first understand whether this person knows what they are doing or not. Now, many of doctors are really good at talking, so it's very difficult to go across that talking and see behind this.
Yeah.
So you have to see pictures. You have to ask for pictures. Don't feel ashamed of asking for pictures, and see if there is a pattern. If you see good results, if you see that the pictures have been taken properly, sometimes, with makeup, without makeup, and pre-post, you have to really, critically see those pictures and see whether this is something which you would like to achieve. The other aspect of, deciding for a surgery is the hospital. Now, many surgeries are done in suboptimal conditions just to cut on cost. So they are done in places which are not accredited. To cut down on the cost, they will bypass many measures. And while doing that, they can end up harming or putting a patient into danger, whether, let's say, it's
patient's well-being.
Whether it's infection control, whether it's sterilization, whether it's, the whole system of surgery, starting from preoperative up to the discharge or let's say follow-ups, there are stringent guidelines which we have to follow. And to cut the cost, some centers, some countries, some hospitals, they will just cut down the cost by bypassing all these stringent protocols. And that's when damage happens. That's when people end up with complications. So I'm against two things. One, if you have to do a surgery, do it in your home country. Do it near the doctor where you can just go to the hospital. Approachable. And you should always have your doctor's number. Gone are the times when, nobody had the doctor's number. You can just go to the ER and say that I have been operated, I have this problem. Nowadays, you have to be approachable. If as a patient, I want my doctor to attend. If I have an emergency, I want my doctor to attend my call. If I text the doctor, at least by the evening or at least, in a few hours, he should reply to me. This is my expectation. And I try, even though it's really uncomfortable to me, to answer all my texts, to answer all my calls. Sometimes I'm in surgery, I don't pick up calls, but at least I try to reply all my messages if there is anything. So whenever a person is planning for a surgery, two things: approachable and qualified and experienced doctor, accredited good hospital. Really important, equally important to go for a hospital which is accredited, safe environment where you're going to do a surgery.
Right. Thank you very much for highlighting the importance of doing a good background check before you choose a doctor, before choosing a hospital, having that awareness, that knowledge before going forward and seeing someone, just for not ask it for direct diagnosis or advice like artificial intelligence, but at least have some sort of awareness for discussion purposes with your doctor. And make sure that you're going with an institution that you trust.
Absolutely.
Definitely.
So important.
Thank you very much for highlighting that, Dr. Faisal. Do you often see patients that require revision surgery, and how often is revision surgery actually needed?
So in my experience, I would say that almost 30% of the requests are resurgeries. Sometimes, the primary surgery has been done abroad, sometimes, in the same country, sometimes it's me, sometimes my surgery would require a revision. In all these cases, it's really important to understand that revision surgeries are something which are not possible all the time. Of course, there are things which can be done to improve what has gone wrong, but the reality is that this is not an exact science. I mean, medicine itself is not an exact science. It's not like an ATM that you put in a code and you get cash. Even an ATM can have an error. So medicine itself, or surgery, or when we're talking about plastic surgery, it's based on science, it's based on experience, but every person is different. So one patient can get an amazing, fantastic result, and the same patient with the same surgeon might not. So also important to get good communication of expectation versus reality, and what you are thinking in your mind as a patient, and as a surgeon what I am thinking is good for you. So that has to match to get in the right place. Also, I compare it with driving. Like driving, no matter if you are a driver for 10 years or 15 years, you still have to do the mirror check, and you still have to give indicators, and you still have to be, on point and alert to avoid accidents. So same is with surgery. You have to be on point, you have to be alert just to avoid, getting into trouble. But when it comes to revision surgeries, most of the times we are able to do something which will improve, whatever problem is at hand. But sometimes it's really, time is a great healer. Sometimes we just have to wait and watch and, do, let's say, non-invasive things to get things right.
Amazing. Thank you very much for highlighting that as well, Dr. Faisal. Now, since Thumbay University Hospital is part of an academic environment in the Thumbay Medicity, what advice would you give Gulf Medical University students and medical students in general who aspire to become plastic surgeons?
Thank you. Thank you for that question. So, I'm really passionate about what I do, and I love plastic surgery as a branch, and if given a chance to redo everything and do it all over again, I would still choose plastic surgery. So I'm here by choice. So, but there are challenges. One is that it's something which requires a lot of let's say study, not just theoretical, but also let's say human study, what people are thinking and what people want. It's not as simple as, let's say, a stone in let's say a gallbladder or kidney, which of course it's devastating, it's painful, it's something which is unacceptable and should be treated. I'm not trying to belittle that, but plastic surgery on the other hand requires a lot of let's say understanding in the mind of the patient, rather than just achieving something which is physical. So that's one. It's not black and white. It's not that simple.
You need to be good at that, or
yes. Also, it requires a lot of training. It takes years, so it's a long process. So you should not give up in becoming a plastic surgeon. It requires years of training. It's a wonderful branch. It's fantastic. It's really rewarding. It's something, especially reconstructive. When you do it, you get immense joy when you see your patients. Even cosmetic, when they see the change and what that change brings up in their life, when in their work, in their relationships. Definitely. How a small change on themselves brings that change. It's amazing. It takes a lot of time. So it's a great branch. I would say consistency, like in all other branches of medicine, it's true, but especially for plastic surgery, you have to be consistent. You have to constantly achieve, or let's say strive to achieve something better each day. Like if I'm doing stitching today, my stitching tomorrow should be slightly better than that. And that's how you end up with better looking scars and better looking let's say shapes results and bodies. So your results keep on improving, and it requires a long journey, but it's an amazing branch. It always keeps you on toes. You always have to think, what next? What is my backup plan? What is next? And what is the best for the patient? What else can I do? It stimulates your mind, really.
Amazing. So you touch the quality of life of the patient, and what I can also take away from your advice is that you need to be a patient doctor and understand your patients, talk to them thoroughly, spread awareness, counsel them, actually invest time into conversations with the patients.
Absolutely.
Rather than rushing for perfect results.
Yeah.
Amazing. Thank you very much for highlighting Dr. Faisal, and for sharing your great insights with us about plastic surgery and the beauty of reconstructive surgery.
Thank you.
It was a pleasure having you today.
The pleasure was all mine. Thank you.
And thank you very much to our listeners for watching and listening to us till the end. See you in the next episode.